strong and healthy. Or so it seems. You've provided proper nutrition management, exercised careful preventive health care, and nursed back to health any sick animals in the flock. As a sheep or goat producer, you know the damage that disease can inflict. One sick animal can spread disease throughout the entire flock, resulting in death and significant financial loss. And what could happen if a disease that currently has no vaccine or treatment and has no live animal diagnostic test to confirm its presence were to get established? One such disease is Scrapie. But what do we know about Scrapie? We know that Scrapie is an infectious disease that has affected sheep and goats for more than 250 years. It is a degenerative disease that affects the central nervous system, and it was first found in the United States in 1947. While Scrapie has been primarily reported in the Suffolk breed in the United States, the disease has been diagnosed in many other breeds and crossbreeds. Although it is generally accepted that Scrapie is an infectious, contagious disease, its means of natural transmission are not fully understood. Scrapie is believed to be transmitted from ewe to offspring at birth, or to other lambs born in close proximity. In fact, younger lambs are considered particularly vulnerable to infection. The causative agent has not yet been identified. Infected animals may appear normal for 2 to 5 years before clinical signs are noticed. Some infected animals may never develop clinical signs of the disease during their natural lifespan, and it is unknown whether they pose a risk to other sheep. A factor that makes early diagnosis of the disease difficult is that the early signs of Scrapie involve subtle changes in normal reflexes, behavior, and temperament, and thus often go unnoticed. An affected animal may appear apprehensive or excitable, particularly after increased activity or after hearing sudden noises. The animal may isolate itself from the rest of the flock, or the flock may actively reject it. In the intermediate stages of the disease, sheep may scrape or rub against fixed objects due to an itching sensation. The scraping or rubbing may be subtle and go undetected, or may be severe enough for the animal to rub off a substantial amount of wool. With stimulation of the lumbosacral area, the animal may experience rapid lip tremors, vigorous chewing, darting tongue movements, and grinding teeth. It may also lose weight and become emaciated, despite no noticeable loss of appetite. In the advanced stages of Scrapie, animals experience progressive incoordination and in severe cases may not be able to stand. Changes in the manner of walking include high stepping of the forelegs, bunny hop movement of the rear legs, swaying of the rear end, and stumbling or falling. Other clinical signs include biting of the feet and limbs and tremors of the head and neck. Affected animals may appear normal if left undisturbed, but sudden noises and movements may cause the animal to tremble, suffer convulsions, or stumble and fall while attempting to run. An infected animal may exhibit all or just a few of these signs, and clinical signs may not be noticed for up to 4 years after infection. After the onset of clinical signs, infected animals usually live from 1 to 6 months. Obtaining a diagnosis of Scrapie can be complicated by the fact that other diseases or problems can exhibit similar clinical signs, including ovine progressive pneumonia, rabies, listeriosis, louse or mite infestation, pregnancy toxemia, and toxins like pesticides and poisonous plants. As soon as you suspect Scrapie, let a licensed veterinarian examine your animals to determine the problem. Dr. Linda Detweiler of the United States Department of Agriculture's Animal and Plant Health Inspection Service has worked with Scrapie-infected sheep for many years. She knows all too well the difficulties in dealing with the disease.
It's very important for producers to recognize the signs of Scrapie as early as possible, especially if this is the first case in your flock. And the reason being that if you catch it early and you separate that animal, you run less of a risk of having that one animal expose the rest of your flock. If you miss that first case in your flock, that animal sheds the agent and infects other sheep, you might not know until 3 years down the line how bad of a problem you have if you miss that first one, because those animals are infected at that point when that animal's there, and it's not until 2 to 3 years later will they show signs. So animals in your flock will show signs of the disease. So you might be sitting on a time bomb.
To protect against the spread of the disease, it's important to detect signs of Scrapie as early as possible. If a veterinarian determines that an animal is infected with Scrapie, the animal will be euthanized. Test results from a post-mortem examination will determine if Scrapie is present. If an animal within a flock is determined to be infected with Scrapie, an accredited veterinarian and a state or federal animal health official will help develop a flock plan to control and limit the spread of the disease. The plan includes identifying recent movements into or out of the flock. Previous owners will be contacted, and recent sales out of the flock will be traced to help ensure that the disease is not spread any further. Since the ewe is a probable source of infection for Scrapie, all her lambs and others born in the same contemporary lambing group would be considered high-risk animals. It is important for the producer to clean out the facility by removing all the organic matter and then disinfecting. The method of disinfection to use is a 4% sodium hydroxide solution or a sodium hypochlorite solution with 2% available chlorine. The solution is used to disinfect floors, walls, fences, feeding equipment, lambing areas, and any other areas that could be contaminated. To protect producers from the impact of Scrapie on their flock, representatives of the sheep and goat industries, veterinarians, researchers, and state and federal animal health officials met in 1990 and generated a voluntary flock certification program. Through a negotiated rulemaking process, this group developed regulations to enhance the economic value and marketability of disease-free animals while maintaining USDA's focus on disease prevention and control.